Hi guys, in this video we're going to talk about the potential causes of osteoarthritis. That's inflammation in your joints, where the joints are getting thinner, you're getting a little spurring, you're getting a lack of mobility, okay? In the past it was thought that osteoarthritis was primarily a wear and tear situation. As you get older, maybe weight-bearing joints, they start wearing out. But there's been some recent developments in the connection of dental pathogens and osteoarthritis. What they found were there are certain pathogens that were growing in joints that were wearing out, like whether it was a hip joint or a knee joint, that basically normally live in the mouth. And this makes sense to me because that would explain why someone would have a loss of a joint in one side versus the other side with no prior injuries, okay? It's basically the microbe in there that's coming from an infected tooth that's somehow leaking in there, and then your immune system tries to kill it, and in the process it actually kills off the joint. So if you have a history of dental problems, dental decay, a lot of tartar in your teeth, a lot of cavities, you may want to research this area. And I'm going to recommend 3 remedies to see if it can help you. Oregano oil, okay? Pine bark extract, grapeseed extract, because these remedies tend to target microbial biofilm, which is basically the microbe that lives within the calcium shell, which is almost impossible to target antibiotics to kill off these microbes. They're very stealth, they hide in the calcium shell, and they don't normally show up in routine lab testing. So that's why they've been under the radar. I would also recommend glucosamine to help build up the joints, but this may give you a lot of relief. Number 2, insulin resistance. Now, it's been found that 75% of people with osteoarthritis also have insulin resistance, which makes sense because insulin resistance causes inflammation, okay? And for this, of course, you guessed it, it's healthy keto and intermittent fasting all the way, because that's going to drop the inflammation, drop the sugar that feeds the microbes, so it's all connected. All right, thanks for watching. So I want to know what you're interested in as far as a future video. Click the link down below and share some ideas. I want to hear.